We've spent time in this series talking about the harms associated with low birth weight and some of the social structures that cause children to be born with LBW. The natural next step is to ask what we ought to do about it. First, we must back up and ask if we actually have an obligation to do something. Is there an injustice occurring here? Or might low birth weight be a tragic but unavoidable failure of individual parents to take care of their children? This is a good time to back up and remember from our last video that while people are individuals with autonomy, there are structures like poverty or racism that affect their ability to make the choices they want to. Sadie and Jane aren't bad moms who don't care about their children. Rather, they are mothers whose choices are constrained by the systems they are a part of. With proper monetary support and prenatal care, their child's birth weight could have been healthy. The prevalence of low birth weight, particularly among those experiencing poverty and those that are a part of communities of color, is preventable and unnecessary. Therefore, we have an obligation to help. But what should be done?
One promising response to the issue of low birth weight is providing a UBI for parents beginning with pregnancy. Giving pregnant mothers a guaranteed income of around $1,000 per month can help improve the mothers' lives. By helping them pay their rent or day-to-day needs like food, a UBI can help take some of the financial burdens for pregnant mothers. Staying healthy during pregnancy can be costly. We believe that a UBI or monthly check can help with this high cost. Additionally, we believe that this recommendation respects mothers' agency, as they are allowed to spend that money on whatever they choose. Trusting them to do what they need to do for themselves and their family felt like a great solution to us. Daniela Gutierrez, a 28-year-old single mother who has been part of a pilot program in New York City, similar to the one we recommend, described the $1,000 per month as life-saving and that the monthly sum has helped make her a better mother. A monthly check will give these mothers an income they can count on and help relieve some of the stress that comes with the great financial expenses of being a mother. Furthermore, a UBI for pregnant mothers has been seen to be a very successful program, as countries like Sweden have one. Sweden leads the world with the smallest LBW rate at 2.4%. In comparison, the US ranks 31st with an 8% LBW rate. All pregnant mothers in Sweden are entitled to free checks during pregnancy. We think a similar policy in the US has a lot of potential, as providing guaranteed income support to mothers during pregnancy is an innovative and equitable approach that will ease some of the financial stress that also often keeps women from being able to put their health first. From part one of our project, we recognize that Black mothers suffer disparate health impacts, in part because of the persistent wealth and income gap. This recommendation takes action to end these disparities and is empowering mothers with the resources they need to have healthy pregnancies and births. Dr. Zia Malawa, the director of the nonprofit Expecting Justice, has helped set up a similar UBI program for women in San Francisco and said, providing direct, unconditional cash aid is a restorative step that not only demonstrates trust in women to make the right choices for themselves and their families, but could also decrease the underlying stress of financial insecurity that may be contributing to the high rates of premature births in these communities.
The funding for a UBI would, in all likelihood, come from higher taxes, especially from wealthy individuals. This is, of course, unfavorable to those whose taxes would increase. That is a real inconvenience to taxpayers, and that burden should not be diminished. Yet, this burden pales in comparison to the burdens experienced by children who have negative health and educational outcomes because of low birth weight, through no fault of their own. When you compare the two's burdens, we can see that although higher taxes are certainly understandably objectionable by the wealthy, no one can reasonably say that we should prioritize a marginal loss of wealth over the life and health of innocent children. Furthermore, it's not as though the taxpayers will only suffer and have no benefit at all. There are many benefits to a world where low birth weight is less prevalent. First, as we've discussed, low birth weight and health complications are expensive, and much of that burden is passed on to the taxpayer through paying for healthcare. There's going to be a monetary burden either way. Doesn't it make sense to pay to prevent suffering for children rather than paying for the effects? Additionally, there's just a general benefit to living in a world with less preventable suffering, whether or not there's a monetary benefit. No solution is without its problems. Many people acknowledge that low birth weight is a problem and want to find a solution, but would reject UBI. There are many objections to UBIs more generally, but the best argument is that lack of money is not the only thing causing and perpetuating poverty in the US. This argument, here outlined by Lelina Estupin, says that within the US, the program is too expensive and not nuanced enough to be effective. However, in the case of LBW specifically, money is a huge factor. Mothers need to be able to afford nutritious food and prenatal visits for the health of their children, and money can help them do that. While there are more complex structural factors behind this issue, as Estupin points out, in this case, money can help mitigate the effects of those structures and cause better health outcomes for children. We don't want to ignore the other factors causing inequity in the US, but money in mothers' hands is the quickest and most effective way to start saving lives.
Another promising response to address the unjust harms of maternal poverty on children are home visiting programs, such as the Nurse Family Partnership. These programs match low-income single parents, usually mothers, with a specifically trained nurse that visits mothers at their homes for 6 months during their pregnancy and throughout the child's second birthday. The Nurse Family Partnership is the widest used nonprofit home visiting program, operating in 40 states and helping over 33,000 families per year. The nurses collaborate with these parents to teach skills in diet, breastfeeding, safety, and more, address mental health burdens, and help apply for other government assistance programs or jobs. The nurses and parents form close relationships to build trust, allowing parents to feel empowered to care for their children themselves, as one recipient mother put it. This partnership helps the mother by building confidence, finding employment, other resources, and alleviating the mental stressors of parenthood. And it also helps their child. One study found that children born to mothers who received home visits were born almost a week later than those who did not, and weighed an average of 7 ounces more at birth. According to one study, participation in the program showed positive effects that lasted more than 12 years after the visits ended, including a significant reduction in behavioral and intellectual challenges for the children, higher achievement in school, and less mental health issues. In sum, home visits improve a child's well-being later in life, helping to break the cycle of poverty and inequity. While this program and others like it are funded by the federal government, advocates have been calling for an increase in funding, saying that only 3% of families in need currently have access to these services. Expanding access to home visit programs would require an increase in funding from the federal and/or state governments, most likely resulting in a tax raise, much like with the UBI program mentioned before. In a similar line of reasoning, while increasing taxes would cause a loss of wealth for individuals that is certainly a burden, that loss pales in comparison to the loss of autonomy and dignity faced by mothers experiencing poverty and the loss in well-being and emotional and intellectual thriving for children that occurs without these programs. Therefore, from a contractualist standpoint, the taxpayer could not reasonably reject the policy of increasing funding for home visit programs. One main concern with home visiting programs is that they would actually violate the parents' autonomy by forcing their choices or violate their dignity by being overly condescending. While this is definitely a risk, training nurses specifically to form bonds with mothers that establish trust and listen to their voice could reduce this potential effect. Also, nurses provide resources and information to parents, helping to overcome structural barriers of a lack of information or access to medical professionals. They do not make their choices for them. Providing parents with this information enhances their autonomy and dignity by giving them an outlet to express and address their specific concerns and providing them with the resources and information to have more freedom of choice.